What is thoracic surgery?
Yeah, surely. So thoracic surgery is actually a surgical field in medicine where we actually deal with all the diseases of the chest. So starting from your neck below up to your breathing muscle, which is called diaphragm. So what we deal is, for example, diseases of the lungs, diseases of our foot passage, which is we call it as esophagus. Diseases pertaining to our rib, which protects our internal organs of the chest. Also, we also deal with patients having a lot of problem with excessive sweating, which we call it as hyperhidrosis. So it is not a new field. It has been there many decades ago, but getting more popular now because a lot of people know and hears about thoracic surgery from social media, like what we are doing now, TV programs, which I think is very beneficial for a lot of patients out there.
Okay, people know about the thoracic surgery, but they don't know why thoracic surgeon and when thoracic surgeon. So I want to ask you, when to see a thoracic surgeon?
Yes. So as I told you earlier, when a person is having, for example, chronic cough, they have seen many doctors, many outside private clinics, taken medicines.
Chronic coughs for how many days?
Chronic cough can be weeks, can be months.
Can be weeks, can be months.
Yeah, can be months. And they have taken a lot of medication and still not healing them. The cough is persisting. Some people have even blood coming out in their phlegm. So then the main worry is either they're having some cancer or some infections like tuberculosis. So these are the patients that actually can come to a thoracic surgeon where we will investigate further and provide the necessary treatment. Another group of people is whoever having a lot of excessive sweatiness. Now this is a big problem among a wide variety of people where they do not know exactly there's a treatment going on. So what we can offer is that we can offer some remedy to these patients.
Doctor, I want to share information with you that is very, that I am very sorry to say that most of the people in our country are going to take the antibiotic without any prescription, without any consultation. That is very sad. What do you think about this topic?
Correct. I mean, I'm not really surprised with that question because even in our country, in Malaysia, a lot of people do the same thing. A lot of patients try to become doctors themselves. That is where the problem comes. They try to self-treat, self-medicate. Then what happens? If you have an early disease, you are actually letting it go, and instead of treating at early stage, you come at the last stage. So then we can't really do anything much except giving tender loving care, some pain relief.
Then early diagnosis is early treatment.
Exactly.
So early diagnosis is very important, and people have to understand that if I have any cough for a few weeks and have blood, then I have to go to the thoracic surgeon, right?